Hey guys, this is my concept map, and yeah, here's my presentation of it. So, this is John Adams, that's his pseudonym. He's an 87-year-old male, and part of his social history is that he lives in Baja California, and he has a history of skin cancer, so he has to travel up to the VA each week for medical care, which is about a 3-hour drive for him. His reason for admission was that he has a new atrial flutter with rapid ventricular response found at his cardiology visit when he was at the VA. His home meds are listed there. The most important one we're going to have to look at is the lisinopril. And that brings me to my Beers evaluation. So lisinopril and aspirin were the two medications that I chose. And lisinopril is to be used with caution in older adults with renal impairment. And we're holding the lisinopril by the doctor's orders because he has an AKI related to his atrial flutter. And then aspirin. Aspirin is to be used with caution in adults over 80 because of the side effects. And since aspirin can increase bleeding, what we're worried about there is GI bleeding and intracerebral bleeding. And it's supposed to be on a case-by-case basis, but I found since he's on Eliquis, the aspirin might not need to be continued. So I organized this into 3 problems. He has his atrial flutter RVR, then he has complications caused by the atrial flutter, which is heart failure with a reduced ejection fraction and acute kidney injury, and then his third problem are his chronic conditions, which is anemia, melanoma, renal dysfunction, and coronary artery disease. So first, his new A-flutter RVR. We found that based on his EKG readings, and some of his symptoms were shortness of breath and increased troponin, and this was due to demand ischemia. They did a transesophageal echocardiogram and then cardioverted him, and it converted him into a sinus tachycardia, which is a successful conversion. Then he has a heart failure exacerbation. His ejection fraction dropped from 58 to 46% when they did the echo. And this is caused because the increased heart rate is there's low filling time, not enough time for the ventricles to fill, which results in a lower stroke volume, and it led to a heart failure exacerbation. And the assessment that we found for this was crackles in his lungs and an increased BUN. He also had the complication of acute kidney injury, which was due to low stroke volume caused low cardiac output, which caused poor renal perfusion, and eventually that caused the AKI. This was evident in his elevated BUN and creatinine. The interventions for these complications, we diuresed with Lasix, and we held lisinopril due to nephrotoxicity, which would help the AKI resolve, especially once we resolved the decreased perfusion from the A-flutter RVR. The prognosis for these issues is that the crackles had already decreased when I took care of this patient, and his renal labs were trending down, and he should recover from these exacerbations soon. His third problem are his chronic conditions: anemia, melanoma, renal dysfunction, and coronary artery disease. These are evident by the assessment decreased urine output for his renal dysfunction. Low iron levels show his anemia. His suprapubic catheter also shows renal dysfunction. Right-sided weakness is evidence of past coronary artery disease complications. And then shortness of breath due to anemia because he didn't have enough hemoglobin to adequately oxygenate his tissues. So these are all pretty stable, and he's expected to continue his long-distance medical care from Baja. As far as his gerontologic considerations, his age decreases his ability to compensate, which increases the acuity of his symptoms, and it's going to elongate his stay in the hospital. The effect on his lifestyle is that his age increases the number of chronic conditions, so he has to come from Baja to San Diego weekly. And then finally, our considerations for his age in relation to his care is that I explained to him why his care was different because of his age, and then I advocated for planning his care better to come from Baja to San Diego, and then we let the social worker know about his situation. Thanks, guys.